Good afternoon and welcome everyone to VolunteerNC's Learning Together Disaster Series. Our goal is to support you, our partners, by hosting trainings and presentations that will equip you with information about services, programs, and opportunities to help you plan and respond better to future disasters. My name is Luz Sanabria, Disaster Service Manager at VolunteerNC. And I also will be the host for this presentation. Today's presentation is on FEMA's Disaster Case Management Program. But before I introduce the speakers, let's review some housekeeping reminders. And so let me go ahead and share my screen with all of you. Let's see. All right. Can everyone see the PowerPoint? Okay.
I can.
Thank you. All right. So housekeeping items for today. This presentation is being recorded and will be uploaded to the VolunteerNC YouTube channel. Today's presentations is scheduled to last for an hour. This includes Q&A. Save your questions for the end of the presentation. Keep your microphone muted to prevent interruptions. And any materials from this presentation and the link to the video will be shared via email. And we also will be sending a survey at the end of this presentation. I'm sorry, not at the end of this presentation, but on Monday. If you can help us, please, by completing that survey, will be great. Let's see. Let me move my screen a little bit. Okay. And so today's presenters, we have Brenda Morris, Individual Assistant Program Manager from the North Carolina Emergency Management. A little bit about Brenda. Brenda, as a trained social worker, emergency management individual assistant was the place Brenda could share her joy of serving others. With years of higher education at Winston-Salem State University, North Carolina State University, in North Carolina Central University, she has learned from and experienced a variety of North Carolinians. Those life lessons helped to prepare her for her entrance into individual assistance as a reservist over 10 years ago. Hired permanently in 2012 as a grants manager. Brenda has advanced through the ranks and is now the Individual Assistant Program Manager. Not only does she have knowledge of individual assistance, but also public assistance and vision as how the two can do and should work. Our second presenter is Tammy Brown, FEMA's Community Service Specialist. In her role, Tammy is responsible for the management of 4 programs: Disaster Legal Services, Disaster Unemployment Assistance, the Crisis Counseling Assistant, and Training Program in the Training Program and the Disaster Case Management Program. As part of her duties in this position, she works with multiple stakeholders and partners in order to deliver services directly to survivors. Prior to her current role in joining FEMA, Annie, like she likes to be called, served as the American Red Cross Europe Office Coordinator at the Medical Center in Landshut, Germany. During her time there, she worked with multiple government, military, civic, and social groups and agencies in order to ensure all military personnel and their families will be supported in the event of any emergency incident. She also worked with the Army Garrison Rhineland Emergency Management Unit to promote coordination and collaboration between the American Red Cross, Europe, and the United States Army. While in Europe, Annie was able to finish her master's degree in Homeland Security with a concentration in emergency management. And she also has 2 bachelor's degrees, one in public health and the other one in emergency management. Annie currently lives in Stafford, Virginia with her husband, 3 children, 2 dogs, 4 cats, and 2 saltwater fish. And so with that being said, I would like to welcome Tammy and Brenda. Tammy, Brenda, the floor is all yours.
Thank you so much, Luz. Good afternoon, everyone. I think from that introduction, you can really say it is absolutely safe to say that I am an emergency management nerd. I'll just throw that out there. And I have been with FEMA for 5 years, so I've really gotten into individual assistance, which I really enjoy because those programs do directly touch the survivors' lives, which we need to make sure that we help the survivors as much as we can, because if we fail to do that, then the fabric of our society begins to break down, which is another reason I'm a huge emergency management nerd. You can go to the next slide, Luz.
Okay. Let's see. There you go.
Awesome. So disaster case management. I'm going to say that is one of our biggest programs. It has more stakeholders and has a wider reach, I think, than many of our other programs. Ordinarily, it is a program that the state or a state agency applies for. They work with a management agency, which is generally a nonprofit organization, and they reach out to the public and the other stakeholders down to a county or a city level to all work together. It is direct survivor assistance. It is basically helping a survivor get to their new normal, which in any incident, we cannot take a survivor back to how everything was before, whether due to not having resources or having them have to move, or even as much as the post-traumatic stress issues that they could have from being in an incident. So all of this works together. We have to consider also, when it comes to disaster case management, if it's not for all of you, we don't have a program. If there are no resources, there's no program. We don't, as FEMA, we're not supplying all of the resources and all the funding for the resources. What we do is we're basically giving that assistance to the recipient in order to bring everything together in one location for the survivor. Being able to bring everyone into those locations together helps to ensure that all unmet needs are taken care of. They do a lot of coordination with all manner of federal agencies, social agencies, civic organizations, social organizations, nonprofit organizations, non-governmental organizations, and many others. It can go all the way down to the local corner church. So bringing all of these together to work for the benefit of the survivor is what disaster case management is really about. You can go to the next slide, Luz. So in order to apply for the DCM program, there is an application. It has many questions on it. Currently, we're revamping those questions to make it more narrative. The main point is to see the big picture. Sometimes from a regional FEMA level or a headquarters FEMA level, we often don't know what it looks like on the ground. We need to see the big picture. So as part of the application, we have the justification brief. Again, this is where all of you play such an integral part in that justification brief via the needs assessment. The needs assessment is going to be anything that you see. I always suggest to the IA person at the state level, or if they know who they're going to use as a provider for this program, to always reach out to those areas that have been impacted, because all of you know what it looks like on the ground. You are seeing what the unmet needs are. You are seeing the number of survivors that need assistance. You are hearing the areas that need the assistance. Sometimes we may not have a disaster recovery center in the right location. We always like to rely on your input to get that real picture. Now, granted, there's other pieces that go along with the application. There's the work plan, how they plan on getting the work done, who they plan on hiring, what types of positions, but it's all based on the needs. Luz, you can go to the next slide. There we go. So when it comes to disaster case management, when it starts to get off the ground, the state has to decide, or the recipient, whichever state agency decides to be the recipient, needs to decide what kind of organizational structure it will have. In many instances, there are some states that don't have the capacity to actually manage the program, to hire the staff, to handle the daily workings of it. So what they would do is they would rely on a management entity. In many instances, these states will have a contract in place with a management agency, whether it be a larger nonprofit organization or a local civic organization, whomever they choose to, or whoever passes their request for proposal, I guess you would say, however that contracting and procurement piece would work. That management agency and entity would end up hiring the providers, either contracting with them. And those providers are normally organizations, agencies, groups that are at the local level. As an example, if you are looking at an incident that's multi-county, the state may have the capacity to do a small disaster and may not need the management entity, so are able to hire their own providers and contract with them. But sometimes when it's multiple counties, as an example, Florida had 21 counties involved. That was a little bit too much for the state to handle. Sometimes, I know there was a recent one in, I want to say, South Carolina. It was only 3 counties. So depending on the scope and what the state emergency management agency already has in place, will really decide what that organizational structure looks like. So again, you can see from the bottom of there, I put that in there as well. The state, and if there is a management agency, they're going to rely heavily on the information that you can provide to them to help build that application. You can go to the next slide, Luz. So, what is disaster case management? What exactly does it do? It is empowerment, is what I like to call it. A survivor may not have the pre-planning set, the prepping done for when a disaster hits. So disaster case management is there to help them learn, to guide them on their path to recovery. It also helps them to take part in that. So the disaster case management program will help connect the survivor to all sorts of needs they may have. They may need mental health. They may need housing. They may need, if in a flood, they may need a muck and gut. They may need mold removal. They may need a roof, whatever the need may be, and they're not able to know who to contact, where to get the assistance, how to do any of this. That's what disaster case management is. It is that one location where the survivor can go, please help me. I don't know what to do. And the disaster case manager will sit down with that survivor, discuss what's happening, where they are, what needs they have, develop a recovery plan. So that way the survivor can have a timeline for themselves of what they can do now, what they can do in a month, what they can do down the road. It's very important to have them be a part of the process, because not only is it helping them now, but it's also helping them in the future. Unfortunately, there are locations that may experience multiple disasters in a year. If a case manager can help someone in this disaster, they're going to be much more prepared for the next, which is always response and recovery go hands in hand with preparing and planning. Because it's not, like I said, we're never going to be able to get all of us back to what it was before, but we're going to prepare ourselves for the next. Luz, you can go ahead and go to the next one. So again, going to those resources, all of you can bring something to the table. You may know groups that do repairs. You may know groups that have clothing. You may know soup kitchens. You may know places that may give not healthcare, well, even healthcare or childcare to help a survivor find a job. You know what's going on in your communities. You have that pulse. You have the connections. You have the relationships pre-built to help support this program. Because without all of you and without those connections and those relationships that you have, the program will not be positive. That's why you are so important. You can always work with your VOAD. You can work with your long-term recovery groups. Many of you are probably already part of long-term recovery groups. Those are very vital to the program. In many instances, some needs may be more difficult to meet. So the case manager may have to go before a long-term recovery group and request assistance. We call it case presentation. It's that last-ditch effort. Some LTRGs may find funding for different material items that are needed. Some long-term recovery groups may have members that have a particular resources that's needed. So we all come together to help get those last unmet needs. So you can all see where all of you fit into this. Luz, next one. The disaster case managers. The disaster case managers are very vital. They are that connection. Along our programs, we've found that it can be frustrating. It can take a mental toll. It can just be plain difficult for a survivor who is trying to go through the steps to recovery. But every time they have a new need or every time they have a new question, they have to come into contact with somebody new. They may have a person for housing. They may have a person for different funding that they need, different social programs that they might need. Then they have the disaster case managers. What we've done is we've pulled all of this information into one location for the case manager to be able to do that, to help guide the survivor. So that way, if they need to meet a housing inspection, the case manager can be there to assist, can be there to help. That is that face, that support that the survivor needs. Someone they can count on, someone they can reach out to. And it can be just as simple as, I don't have any diapers for my baby. Can you help me? Disaster case managers are there to advocate for the survivor, whether it's working with a resource coordinator, which is a position, whether it's a state or a VOAD or a FEMA resource coordinator. That's the person who is out there looking for more resources, more ways to get assistance for those survivors. So that the disaster case manager can have a point where they know they can go to find those needs. It's the hand and the shoulder that the survivor may need to hold or to cry on. They're generally people from the area that's been impacted. In many cases, they will be students that are working to become social workers. They are retirees who were social workers or teachers, just different people from the community. In many cases, they're even survivors themselves. So they're really there to understand, to help, to guide, to empower that survivor to get back on their feet and to get back in a place where they're able to handle everything themselves. So the disaster case managers are the heartbeat of this program. Next slide, please. I will turn it back over to you, Luz.
Thank you. Thank you, Annie, for this wonderful presentation. And now we are transitioning to Brenda Morris, individual assistance with the state of North Carolina Emergency Management.
Good afternoon, everyone. Thank you, Anne, for taking the time to speak to North Carolina citizens. One of the things we want to talk about is how does the state recognize the need for disaster case management? In Hurricane Matthew, we recognized then that we had a number of counties and let's just say over 30 counties that were impacted. One of the things we did, as Anna said, we completed an application, we did a needs study, and then requested disaster case management assistance. That was delayed to some point because we had to search for a vendor. Learning from that lesson, what we've done now is we developed a bidding system with the purchasing and logistics to have our vendor applicants on contract prior to a disaster. So today I just want to talk to you briefly about how that vendor bid is conducted. Below you will see that there is a link. North Carolina Public Menu is the vendor portal that purchasing uses for any person who's interested in participating in the bidding process. And they can select what commodities or services they are willing to provide to the state. Next slide, please. If you click on that link, North Carolina Public, it will bring you to this portal's vendor portal. You will be able to go into the portal to register. It also, once you are registered, you will be able to see all the vendors that the state has contracted with for whatever particular service they are able to provide for us. In this case, disaster case management. Next slide. So this is an example, next slide, of what the vendor registration will look like once you click on that registration. If you are interested in this, it is very important that you go out and you register for this. We do our contracts every 3 years. So we've already had a bidding for the next disaster case management event that we may possibly have. So in the future, if you feel that you're going to be interested, make sure that you get on this vendor portal and that you register for this. Next slide. This is, and let me just say, this is not manned by North Carolina Emergency Management. It is manned by the purchasing and logistics. So we have no input on the vendors, or we have no input on the registration. But once you register, a vendor is once you're registered and it's posted, an email will be sent to you, the vendor, to let you know that we are about to put out a bid for services, if it is for disaster case management. For instance, last year, I think it was, we put out a bid to have new vendors for disaster case management. If you are already registered, you would get this information, but this information would only come to you prior to the bid being posted. This way, we can make sure that we're doing it fairly and equitably for everyone, so that there's no advance notice for any person except the persons who have been registered. Next slide. Once that's done, then our team from recovery will get the vendor portfolios, and we will review it. 3 to 4 staff members will get together. We will review the information that the vendors have sent to us. We have a scoring system that we rate on what each vendor can provide to our citizens, can provide as far as a budget for to manage the program, can provide how they can provide us with staffing, how they can provide resources to our citizens, because it's very important that we have a vendor that has an array of resources or know how to obtain the resources to meet our survivors' needs. So once we do that scoring, we submit that to purchasing and logistics, and then they finalize the contracts with the vendors. Sometimes vendors will come back and have questions. So then we will go back and answer those questions again for the vendors. And once those vendors have been approved and there is an executed contract, those vendors are noted on the portal. Anyone can go back who's registered. Anyone who's registered can go back and look on that portal to see who the vendors are. So there's no surprise that once we have a disaster, we will be looking to choose from those selected vendors as a person who will be the management entity for our disaster case management program. What is our role as emergency management? We monitor that vendor. How do we monitor that vendor? We try to monitor them with monthly reporting that has to go to FEMA. We do quarterly reporting that has to go to FEMA. We also monitor them by what you tell us, what you communicate to us that might be gaps that you're seeing in the service delivery within your communities. We ask you to communicate to us if there is not good customer service. We ask you to communicate to us if there is areas that the vendor may need some more training in, because it's our responsibility to help that vendor have that training. But in all that we do for the vendor, we would always ask that you as the service providers, you as a community would communicate with us, emergency management, with me as a program manager, to ensure that the vendor that is selected, vendor or vendors that are selected, will be able to meet the case management needs for our communities. Yes, there are times that it may be that we had, I think in Florence, we had 43 counties. And sometimes there may be the need to have 2 vendors. So we try to make sure we have enough selective vendors that can meet the needs of North Carolina at any given time. And again, in order for us to do that, we need your assistance, the stakeholders, to help us. Next slide. So if you have any questions, we are always available to answer questions. We're always available to attend long-term recovery meetings. When that vendor is selected, we're always here for you to provide us with the best practices that you feel are necessary for us to include in our next vendor selection. But I want to thank you. And Luz, I will turn it back over to you.
Thank you, Brenda, for the great presentation that you put for us today, together for us today. And so right now I am going to be opening the floor for Q&A. I was monitoring the chat box while You were doing your presentation, and Heather Black is asking if we can add the link into the chat box, the link for the vendor application process. Do you have that link available, Brenda?
Yes, I will put it in the chat box.
Thank you. And Christy Kohlberg is asking, so the vendor has already been selected. Are we able to know who that vendor is?
Again, if the vendors that have selected should be on the vendor portal for anyone to go out, because it's public information. So they should be there, that you'll be able to see who that is.
Okay, we have another question in the chat box, and it says, what type of organizations, what type of organization what type of organization, I'm sorry, my screen keeps moving up. I have comment and questions. I would like to open video for ASL interpretation to voice for me. That's from Donna Platt, but there's also a question before that that says, what type of organizations serve as vendors?
Most often it's vendors who have had previous disaster recovery work. We have many vendors from across the country who have experience working in various disasters in, for instance, Louisiana, Texas, California. Those vendors will apply. They usually have experience working in not only individual assistance, but public assistance as well. I wouldn't say that they're necessarily human service agencies, but they're agencies that, again, have had experience working in disasters.
And to the interpreters, feel free to unmute yourself for Donna's questions.
Hi, everyone. My name is Donna Platt. I'm the Emergency Preparedness Coordinator with the North Carolina Division of Services for the Deaf and Hard of Hearing. I wanted to share a situation that happened during Hurricane Florence. We did have a deaf consumer that was impacted by a flood from Florence. So we were helping that person get some case management. And I'm not talking about the long-term group. We're talking about the agency that was on the ground providing that case management. The challenge that we noticed was communication barriers. We had explained to the agency that was taking care of case management that the customer was deaf. The person explained that they would need communication access, but it wasn't really successful. They decided to set up a meeting, the case manager. They weren't able to get a sign language interpreter because it was a last-minute request. I tried to explain to them what the process was to meet their communication access needs. They tried to write back and forth with this person, but English is not their first language. The stress of a disaster. The person also had children, so many complications going into communication. It was just hampered. So my question being from that situation, I would love your presentation to include access, communication accommodations. If FEMA could add a section. So, for example, when you're providing services and as a case manager, this is how you provide communication access, how to prevent barriers from happening in communication. You know, I would love to present to your group of case managers once they come on board for any disasters. We do provide communication access resources. We would love to do that. I know things move so quickly in disasters. I understand that. But we still need to think about removing these barriers. It's already a traumatic situation. And that's part of my job, and I'd love to do that. I do have a communication access manager as well at my agency that would help provide any training to these vendors that you bring on board in advance to a disaster. Even during the disaster, I know that they receive that funding. So I'll have to talk to Brenda and those at FEMA to make sure that those resources are there and available for these vendors. So I think it's something we really need to think about, and we need to think about that in advance of a disaster. Anything we can do to help you in the future with this at FEMA, we'd be happy to do so here in North Carolina.
Donna, this is Brenda. We definitely would be very interested in you providing training to whatever vendor is selected for disaster case management. That would be very helpful, not only to them, but as well as to us. So we will try to integrate that in when there is when, and hopefully no time soon, a disaster, but we will definitely add you to that training curriculum. Thank you.
Absolutely.
I'd like to jump in as well.
Thank you, Brenda.
At FEMA, we have been learning lessons. So that is one of the positive outcomes from every disaster. Unfortunately, we have the disasters, but learning something is important. We have started changing our applications. This is being done with the crisis counseling program, which I did. I was the one responsible for the changes in that application. It currently sits with the Office of Management and Budget to officially change that application. We have also submitted updated DCM applications for review as well with the Office of Management and Budget. The reason these applications were changed is we found there were a couple gaps. On mine, especially for crisis counseling, we had decided that there was a section where they had to describe how they were going to reach certain populations, whatever that population was that's in their area, whether it be an immigrant population, a deaf or hard of hearing population, or anyone with any kinds of an accessibility need or an inclusivity need. So what we've done is we've added questions more pointedly to that in these applications, where that they have to describe how are they going to include these populations to ensure that no one gets left behind, no one gets forgotten or missed or overlooked. We're really doing a push on that. Not only that, is the Office of Management and Budget has also decided that it used to be, it's how compliant grants were, whether they were following the rules, whether they were putting in their monitoring information, whether they were submitting reports on time. Now they've moved from compliance to how well the program does. What are the good points to it? What we've learned from it. So it's how it's, I can't remember the word, it's how it performs, which is another reason for adding in all of that information about how these programs plan on reaching. Because if you're forgetting someone or you're leaving a population unhelped, for lack of a better word, that's a failure of the program. So now the performance point is making sure there are no failures. There's also when an application is being submitted, they have to, the applicants, whether it be the state or whomever, has to submit a budget. As part of the budget, we do allow for interpreters, whether it's sign language, whether it's written interpretation of documents or any of that. So that funding is allowable as part of the program as well to ensure that it is there. We've even gone so far at FEMA to, when we have our disaster recovery centers, they will ensure that if there are any populations that need some type of specific help, that it's available at that disaster recovery center as well. Because we don't want to leave anyone out. We don't want to forget anyone. So we're really, that is a very big push with FEMA right now to ensure that we've got that inclusivity. So that will only get better, and we will keep learning, and we will keep making it better. So we're not gonna shy away from that.
Well, thank you. This is Donna. Thank you so much for explaining what you've done in support of us. We appreciate that.
Thank you for the great question, Donna. I have another question in the chat from Heather. Are there any vendors from North Carolina? And this question could be for, well, it's for Brenda.
I can say yes. There were some vendors that applied that were from North Carolina.
Thank you. And I would like to say that if you want to ask a question, feel free to unmute yourself and ask the question. Now we have from Daniel, when I visited the bid platform previously, it was a little overwhelming with many bid opportunities. Can you walk us through finding the specific bid for this DCM contract?
Daniel, I will have to ask the purchasing manager to contact you to walk you through that, if you would. It is not our portal, so I don't want to give you the wrong information, but she will make herself available to assist you on that.
Okay. Thank you very much, Brenda. And that might be something I would assume others might have that issue. So could we set that up as something bigger than just for me, or at least put that out just to save them time?
Yes, I will ask her if we can set up a time for that.
And we will be more than happy to host that presentation for all of you. Let's see, there's another question. Let's see, for the approved vendors, are any for North Carolina? I also cannot find the list for approved vendors, and that comes from Heather.
Again, Heather, I will have to let purchasing follow through on that, if you would.
And let's see, there's a hand, I think is John Robinson. Go ahead and unmute yourself if to ask your question.
Okay, this is John Robinson, and I am working with a vertically integrated long-term recovery group that's planning to continue working. And we have had for the last 4 years having to do our own case management because of the failure of the broader FEMA and North Carolina State case management system. So we're doing an audit right now of our 1,800 cases to go through and demonstrate who was helped and how. My question is it envisioned in this plan that a long-term recovery group like ours could apply to do their own case management?
For North Carolina, for you to be a part of the funding from FEMA, you would have to register and apply as a vendor, and then we could review your application as we would do any other vendor.
But is it envisioned that we would have to be prepared to cover the whole state in case there was a disaster?
John, I can only tell you that you would have to apply. And there is a time that there are situations where we may have to use numerous vendors, but the key is to register and to be approved. And from there, we can determine the need, if we need one vendor to handle the entire state, or if we have multiple vendors to handle different counties of the state. So that would be how we would have to work that.
Okay, thank you.
Thank you.
Anyone else has any additional questions? I don't see anything in the chat box. So I'm just giving one last opportunity for anyone else that might have questions. Okay, so it seems like no other questions. See, no other questions in the chat room, and I don't see any other additional hands raised. So this conclude our presentation. I want to apologize for the technical difficulties we were having at the beginning, but thank you for your patience and the feedback that we were receiving during that time. Thank you to Brenda and Tammy and all of you for attending. Next month, we will hear from Kelly Nielsen and Dr.
Recording
Allen,
in progress.
And Dr. Allen from the Department of Agriculture. And that
Recording stopped.
will be next month on the 23rd. More information to come regarding the registration. And so thank you again for attending, and please be on the lookout for the email with all the information related to today's presentation. And thank you again.